Thank you for joining us this morning to discuss vaccines and their administration. My name is Karen Curtis, and I am a Provider Outreach and Education Specialist here at WPS. Today, I am joined by my good friend Aline Sigler. Aline will be monitoring the chat for questions, as well as providing you with some additional information and links. With cold and flu season upon us, I thought vaccines and administration would be an appropriate topic for this month's webinar on preventive services. I know that many of you will become quite busy in the next few months with patients making appointments to receive their vaccinations. Here at WPS, we do our best to provide you with accurate, up-to-date education. If you have worked in Medicare for a while, you know that Medicare rules and regulations can change. For this reason, the CMS website should be checked for updates, and the federal regulations take priority over anything that's presented today. We answer questions based on facts given. Any changes to that information may change the response given, and we are not able to guarantee payment for services. Medicare rules will always determine final coverage of services. I'd also like to take this opportunity to remind you that if you have claim-specific questions, we do ask that you contact customer service. They have the ability to access your claim and can provide an answer based on how your claim processed. Lastly, I need to let you know that CMS does prohibit the recording of this webinar. As I stated earlier, we are recording the event so it can be posted to our webpage and YouTube channel as an encore presentation. Here's a look at what I plan on talking about today. I'll start off with a little general information. I'll discuss Medicare coverage for the 3 vaccines, how to bill those vaccines and administration to Medicare, and finally, I'll talk a little bit about beneficiary eligibility tools. Now, if you've worked in Medicare for any amount of time, you know that it contains a lot of acronyms. I've created a list for those of you that you will see or hear during my presentation. Many of you may be aware of most, if not all of these, but I like to include them just in case there's someone who's new to Medicare or maybe someone who works in a field or practice where they haven't had to need to know what all of these mean. If I mention any acronyms that you're not familiar with, you'll have these slides for reference and hopefully they'll be helpful. This is the American Medical Association copyright notice for CPT codes. During this presentation, I will provide billing information which contains CPT codes, and this notice lets you know that Medicare does not own CPT codes or their descriptions. We also have a copyright notice from the American Hospital Association National Uniform Billing Committee. This notice is required since I discussed coding that would be included on the UB04 or 837I. The American Hospital Association is not responsible for, nor were they involved in the preparation of this material or the information provided today. I'd like to start out by providing some general information regarding influenza, pneumococcal disease, and COVID. I think we can all agree that getting the flu can really take a lot out of a person. You feel miserable and you have no energy. For many of us, we experience mild to moderate symptoms, which last anywhere from a couple days to a couple weeks. But for many Medicare beneficiaries age 65 and older, the risk of complications increases. Individuals may develop pneumonia, inflammation of the heart, brain or muscle tissue, and even organ failure. The CDC has found that in recent years, it is believed that between 70 and 80% of all flu-related deaths have occurred in those who are 65 years of age and older. This age group also accounts for 50 to 70% of all flu-related hospitalizations. Those with chronic conditions are also more at risk for developing serious flu complications. I've listed a few here, but this would also include individuals who have had a stroke, those with liver disorders and sickle cell disease, among others. It has been stated that 9 out of 10 people hospitalized with flu-related complications has at least one underlying health condition. I don't know about you, but whenever I heard the term pneumococcal, I always thought pneumonia. I didn't realize that the bacteria can also cause meningitis and sinusitis. So although anyone can contract pneumococcal disease, those under the age of 5 and adults 65 and older are at increased risk. Chronic medical conditions and immunocompromising conditions also contribute to being at that increased risk. Diabetes, asthma, smoking, or beneficiaries who may be on cancer medications would also fall into this category. Like the flu, COVID symptoms can range from mild to severe and can last anywhere from a couple days to a couple weeks. There are certain circumstances that can put individuals at a higher risk of complications if they do get COVID. The first of these includes being 65 years and older. It has been reported that more than 81% of all COVID-related deaths occur in people over the age of 65. Chronic and immunocompromised conditions are also factors that may put individuals more at risk for experiencing severe illness from COVID. And they've also found that physical inactivity can play a role. So individuals that are physically active generally live longer and are less likely to be put at risk for serious health problems. Now we'll move on to coverage for each of these vaccines. The flu vaccine is covered under Medicare Part B. Vaccines are typically administered once per flu season, but additional shots may be given if medically necessary. So saying that it would have to be medically necessary, you'd want to make sure if you are billing additional vaccines that you would have the documentation to back that up. Medicare does require that the influenza vaccine and its administration be furnished in accordance with state laws. So on this slide, I have included a link to the Center for Disease Control, or CDC's, vaccination laws. And for influenza, the website provides links for ambulatory care, hospital, and long-term care facilities. Laws related to other vaccines are also available on this site. Medicare does not require a physician's order to receive the flu vaccine, and it may be provided upon request from the patient and given without physician supervision. The service is provided at no cost to the beneficiary if the provider accepts assignment. Pneumococcal vaccines are covered under Part B, and it does not require a doctor's orders. Now, the frequency for this vaccination does depend on the patient's vaccination history. So this slide contains a link to the chart that was put out by the CDC, and it provides a couple vaccination schedule options for individuals 65 years of age and older. While we're on the topic of frequency, I need to let you know about a change that came out last week. CMS released CR 13750, which made some revisions to coverage. These changes were made to align with the Advisory Committee on Immunization Practices. I'm having Aline add a link to the Medicare Learning Network Matters article so that you can review the changes and be ready when they're implemented on November 25th of this year. When I looked at the CR, it does look like they're updating the manual to add vaccine PCV 21, but again, the CR that's making these changes is 13750. As with the flu vaccine, Medicare does not require a physician's order to receive the pneumococcal vaccine. It may be provided upon request from the patient and given without physician supervision. This service is also provided at no cost to the beneficiary if the provider accepts assignment. Medicare covers COVID vaccines under Part B. Frequency can depend on the manufacturer. So on this slide, I've included a link to the FDA Emergency Use Authorization website. And there you'll find a link where you can find additional information on COVID vaccines by manufacturer. Like Novavax, for example, breaks down their recommendations to cover those who were previously vaccinated, those who were not previously vaccinated, and immunocompromised individuals. COVID vaccines must also be furnished in accordance with state laws. Medicare does not require a physician's order, so vaccinations may be provided upon request from the patient and given without physician supervision. This service is also provided at no cost to the beneficiary if the provider accepts assignment. So here's the part that everybody's been waiting for, right? What do you need to include on your claim to Medicare? Here I've listed some general guidelines that are applicable to providers. First, we have institutional claims. These would be claims that are billed on a UBO4 or an 837I. Institutional providers, other than independent rural health clinics and freestanding federally qualified health centers, should include vaccines and their administration on the same claim. I do have a slide coming up that will address the rural health clinics and the federally qualified health centers. The next bullet refers to professional claims that are billed on the CMS 1500 or 837P. So the first one, office visit charges. If a physician sees a beneficiary only to administer a Medicare-covered preventive vaccine, then they should not bill for an office visit. If the beneficiary comes in for a vaccination but receives another service that would constitute an office visit, then the physician may bill for a visit in addition to the charges for the vaccine and its administration. For non-participating physicians and suppliers that do not accept assignment, they may collect payment from the beneficiary when administering preventive vaccines, but an unassigned claim must be submitted on the beneficiary's behalf. Entities who have never submitted Medicare claims will need to obtain a National Provider Identifier or NPI to submit a Part B claim. Now, there is an article on the WPS website that covers mandatory claim submissions, and Aline will add a link into the chat if she hasn't already done so. The last bullet under professional claims deals with separate billing for vaccines and their administrations. This occurs when the vaccine and the administration are furnished by two different entities. So I did receive a question during the registration process that fits the situation. So in their case, the pharmacy is billing Medicare for the vaccine. So they would need to submit a separate claim strictly for the administration. I'm not sure of the specific vaccine, but let's say, for example, it was the flu vaccine. So the pharmacy would submit a claim containing the CPT code for the vaccine, and the entity who administered the vaccine would submit a claim containing HCPCS G0008. Now, maybe some of you are using a system that won't allow you to bill for one service and not the other. And in that case, what you would do is you would submit a charge of 0.01 for the service that you did not provide. And finally, for all claims, the diagnosis code that should be used on the claim is Z23. Here's a list of the institutional type of bills that can be used to bill vaccinations. We have hospitals, skilled nursing facilities, home health, outpatient ESRD. If you are a hospital who will be submitting your claim on a type of bill 12X, you're going to want to use either the date of discharge or the date that benefits are exhaust as your date of service. Providers who submit claims to FIS using the UB04 or 837I will use revenue code 636 to report the actual vaccine and revenue code 771 for the administration charges. Earlier, I mentioned that I would address vaccination billing for rural health clinics and federally qualified health centers. So for these facilities, vaccinations do not count as a visit. So a claim should not be submitted to Medicare. You should, however, include the cost of these vaccinations on your cost report. Now, there is an exception for FQHCs. If there is another reason for the patient's visit other than to receive a vaccination, you would submit the visit on a type of bill 77X, and you would include the vaccine and the administration code only for data collection purposes. Now, coinsurance and deductible would not apply. For claims billed on a CMS 1500 or an 837P, I have listed some specialty codes in place of services. You're going to want to use a code that best describes your provider type. The Medicare Claims Processing Manual, Chapter 26, provides a list of codes. If you're unable to find a code that fits your situation, then code 99 may be used as both the specialty and place of service codes. Now, if you are interested in more information on mass immunizers or centralized billers, I have provided links in the resource slide. I did consider covering it, but it's a lot of information and I wasn't sure that it would apply to everybody. So I figured it was better just to provide the resources, and that way for those who were interested, they could look more into it. The following slides that I'm gonna follow up with here, I'm going to provide you with the HCPCS and the CPT codes that should be used on your claim. For the flu vaccine, HCPCS G0008 would be used to bill the administration. The remaining CPT codes are for the vaccine. Descriptions of these codes can be found on the Medicare Preventive Service Tools website, and a link can be found on the More Resources slide. The last code listed on this slide, the Q2039, is to be used when the vaccine is not otherwise specified. I would also like to make you aware that on Thursday of last week, the MLN Connects weekly edition newsletter included a link to the flu vaccine pricing for the 2024-2025 season. I'm having a link, drop a link into the chat in case that is something that you're interested in looking at. Here is your list of codes for the pneumococcal vaccines. G0009 would be used for the administration, and the other CPT codes would be used for the vaccine. When billing for the COVID vaccination, 90480 is used for the administration, while the remaining codes are used for the vaccine. Now, descriptions of any of these codes that you've seen on the last 3 slides can be found on the Medicare Preventive Services Tool website. And I'll take you out there later to show you some more information that can be found out there. So now that you know what codes to put on your claim, I want to talk about an additional payment that can be made for certain Medicare patients. These additional payments are made when administration of the vaccines must be made in the patient's home because the patient has difficulty leaving the home or faces barriers to getting vaccinated in settings other than their home. This could include the beneficiary having a condition that makes it difficult to leave their home without a supportive device or help from a caregiver, maybe having a condition that makes them more susceptible to contracting a disease. Maybe they're just generally unable to leave the home, like it takes considerable effort. Or if the patient is hard to reach because of a disability, maybe clinical, socioeconomic, or geographical barriers apply. So this can include challenges with transportation, communication, or caregiving. The link provided on the resource slide has a list of locations that qualify for this additional payment. The list includes private residence, temporary lodging such as hotels or shelter, and even assisted living facilities. I will tell you that hospitals and skilled nursing facilities do not qualify for this benefit. The additional payment is only made if the sole purpose of the visit is to provide the vaccine. If other services are provided in the home on the same day, the standard payment amount would apply. And other restrictions can be found by visiting the CMS webpage. So we'll start out with the flu vaccine. Beginning January 1st of 2024, Medicare will provide an additional payment amount for administering flu vaccines at the home for certain beneficiaries. For calendar year 2024, the amount is approximately $38. Medicare will make geographical adjustments based on where the vaccine is administered and will provide an annual update to the payment rate to reflect changes in cost. Claims should include codes G0008 and M0201. As I had stated, no additional services can be provided, and you'd need to look at the website to make sure that the location does qualify. Pneumococcal vaccines are also covered under this benefit beginning January 1st of this year. Claims should contain code G0009 and M0201. The additional in-home payment for the COVID vaccine actually began back in June of 2021. The additional price is the same as the other vaccines. Claims should include codes 90480 and M0201. Again, no additional services should be provided and multiple locations qualify. When you use the link provided on the resource slide, the page will contain an additional link specifically for COVID vaccinations. Most of the information is the same. It does clarify that the additional payment only applies once per patient per date of service in the home. And the example given is if you provide the COVID vaccination and a flu shot. So Medicare will only make one in-home additional payment, regardless of whether you provided one or two vaccines. The last thing I'd like to talk about today is eligibility. There are a variety of different options available for checking eligibility. First, we have the interactive voice response or IVR system. This option provides the date the vaccine was given. And if you're not real familiar with the IVR or if you haven't had a lot of luck with IVR, my co-host Aline has held a series of webinars last month and earlier this month. And those encores can be found on our website as well as our YouTube channel. She also has some coming up, which can be found on our live events page. Second, we have the GHA portal. Now, this is the secured portion of our website, and it does require registration. After entering some required information, such as MPI and patient information, the portal will display multiple tabs that contain beneficiary information. One of these tabs is for preventive services, and it will include immunization dates. Direct data entry, or DDE, is an option for Part A providers who bill using the FIS system. DDE is another tool which requires registration since you have access to protected health information. And when you get access, you'll be able to view 16 pages of common working file screens, which will provide eligibility information. It has everything out there from MSP, HMO, hospice, just anything you can think of. The last option shown here is the HIPAA eligibility transaction system known as HETS. And this involves submitting an electronic 270 file and receiving a 271 response, which will show you the day that the vaccination was given. Now, I have provided a list of resources. The resource titled Roster Bill will take you to the CMS website, which provides information for submitting both institutional and professional claims. It also includes information for mass immunizers and centralized billing. If that's something you're interested in, I wanted to be able to provide that information to you. I'm not sure how common that is nowadays. I know back when Aline and I were examiners, every flu season we would get just a ton of roster bills that we had to key in by hand. So I don't know how much that's used anymore, and I'm sure there's a much easier way than doing it than what me and Aline had to do. Now, the last link is the one that I mentioned earlier, where you can find more information on the additional payment for in-home vaccinations. There are other places that you can access this, which I will show you in just a minute. The second resource slide has a link to the CDC vaccination laws. The COVID-19 vaccination toolkit provides payment rates and billing information. And the last resource is the Medicare Preventive Services tool. And I find this helpful regardless of which service you're billing for. So I wanted to take you out there real quickly here. Aline, can you verify that you can see the website?
Yes, I see the Preventive Services tool.
Great, thank you. The first one that we come across here is the COVID vaccine and administration, so I'll click on that. It does give you the list of codes and their definition. Here you can find a link to the pricing page. It gives you the ICD-10. Here's the other link that I provided for the FDA emergency use authorization. But when you come down here, and this is true for other services on this website, that it gives you other notes. So here's the COVID-19 vaccine toolkit. It gives you some other information here for hospice patients. And here's another link for that additional payment. And this one is the one that is specific to COVID-19. Here's where it gives you the locations that would qualify for the additional in-home payment. If you scroll down a little further, it does give restrictions that apply. Here's the part about giving more than one vaccine at one visit. Here it gives you some examples. If I go back here, if we pick another, and I go to the flu shot and administration, here you can also get a definition. Gives you the ICD-10 code. Now here with other notes, it has a link for most providers bill and get paid for flu shot services. Gives you some information from the CDC, and it also has a link for the additional payment. This one is not specific to COVID, but it also talks about the hepatitis B that would apply for the in-home vaccination administration. It gives you the same information as the other one. And then if I go to pneumococcal again, here's where it has the CDC's, the timing for adults. And this is the one that I brought up where it gives you the two different options for adults 65 years and older. It does also give information for younger patients too. And then in the other notes, this also has additional information regarding the pneumococcal shots that could be helpful to you. So I just wanted to make you guys aware of that, so that you know that there are places that you can get additional information. Okay, so that brings us to the end of the presentation. So I will turn it over to Aline to see if we have had any questions come through in the chat.
Thanks for sharing that information, Karen, and thanks for showing the resources too, because I know sometimes we don't know what what questions we have until we learn a little bit more about it. In scanning over the chat, I do not see that we've received any questions at this time.
Okay, great.
I'm sorry, one just popped in, so sorry. Marilyn says, can a SNF bill for the administration of Shingrix vaccine? Maybe that's the shingles vaccine, which is outside of what we're talking about today. So I don't know if you have any information on that.
Yeah, I'm not familiar with that exact name. So that would be something that maybe could be sent in, but I'm not sure, like you said, Elaine, I don't know if that's for the shingles vaccine or what that is. But that can be sent in, we can take a look.
Okay, and there are no further questions at this time.
Okay. On behalf of myself, Aline, and the Provider Outreach and Education team, I'd like to thank you for being here today, and I hope that you'll join us for future events. You may now disconnect.